Welcome to the meeting. You have 2 minutes to address the committee.
Okay, thank you. My name is Jennifer Muir, and this is regarding single-payer health care. I believe health care is a human right, a right that all Sacramento people deserve, rather than a privilege for the young and healthy that are lucky enough to land a job that will provide it. It's become an unacceptable norm in Sacramento that health insurance premiums go up as much as 6 times for persons over 50 as they are for people under 25. It's also become an unacceptable norm that employers can lay off workers who become too expensive to keep, forcing many of us into low-wage gig work where we must find a way to pay at least $20,000 a year for health coverage at a time when age-related diseases begin to show up in our bodies. It has become an unacceptable norm that an insurance company will do what they can to find a reason to deny coverage to a person who has developed a long-term age-related illness. The number one cause of bankruptcy in the United States is medical debt, and by extension, that applies to Sacramento as well. Tragically, it has become an unacceptable norm that an older person will often have to go hungry, stop taking meds, stop paying rent or mortgage, and risk homelessness in order to pay to save their own lives. It has also become an unacceptable norm in Sacramento that politicians from both sides of the aisle will choose to keep this barbaric system in place rather than adopt a single-payer system. We know that what Sacramento does can have a huge impact on what happens statewide or even nationally. Please join other cities like Los Angeles, Oakland, and San Francisco and endorse our resolution.
Thank you for your comments. Your time is complete. Will you make your final comment, please?
Because people are dying for a new acceptable norm here.
Thank you for your comments. Next caller, please. Welcome to the meeting. You have 2 minutes to address the committee.
Hello, my name is Robert Copeland. I live in District 4. I also support the proposed resolution for a CalCare AB 1400 and Medicare for all. Because a previous caller said people are going bankrupt. People also have to go GoFundMe to pay medical bills. We got a high cost of premiums, deductibles, co-pays. Also, people go to the doctor, get a prescription, go to the pharmacy, and the insurance company will not allow the person get the medication they need. Our healthcare system is totally broke. We need to have some kind of a better healthcare system in the United States, like they do in Europe, Canada, that's cheaper for the person, better quality health care. Thank you.
Thank you for your comments. Next caller, please. Welcome to the meeting. You have 2 minutes to address the committee.
Hello, my name is Jenny Manahan Osgood, and I live in District 7. As a Sacramento resident, I'm asking the City Council to support a resolution in support of CalCare and Medicare for all. State legislation AB 1400 and federal legislation HR 1976 would guarantee high-quality, comprehensive health care for all Californians. 3 members of my family, all Sacramento residents, have had congenital heart defects. My father, a San Francisco resident, was a lineman for PG&E. He worked hard, he saved his money, and bought a little house near McKinley Park. When he passed suddenly at the early age of 38, his house went to a sister whose health suffered due to a congenital heart defect. She raised her 2 adopted children in that house, and when the laws regarding Medi-Cal changed, out of fear, she signed the house over to her son's fiancé. She figured that the house would go back to my cousin when he and his fiancé were married. 5 years later, my aunt passed away. So my cousin and his fiancé moved into the house. Unfortunately, years later, they broke up, and soon after, my cousin succumbed to mental health issues. His ex-fiance still owns the house that belonged to my father and to my aunt. Basically, my family lost my dad and my aunt's house because of health insurance. If we had had CalCare at that time, or Medicare for all, my family would still own my father's house. Again, I ask the City Council to support a resolution in support of CalCare and Medicare for all. Thank you.
Thank you for your comments. Next caller, please. Welcome to the meeting. You have 2 minutes to address the committee.
Hello, I'm Patricia Johnson. I live in District 4. I'm an RN. I've seen a lot of heartbreaking stories because people can't get the health care to prevent diseases or pay for their treatment when they do get sick or have accidents. Please support the resolution to support AB 1400, the CalCare bill in the State Assembly. And also there is legislation in Congress, HR 1976, Medicare for all. Healthcare is a local issue. Everyone will benefit from having guaranteed health care. I know of 2 state workers, college graduates, who could not afford their health care. One man had a life-threatening disease, received wonderful medical care, and he lived, but he was too poor to afford his health care to retire. He went to work every day, wheeling his oxygen tank, getting short of breath, and stopping to get a breath and sitting like a frog in the parking lot. He worked and worked in order to pay for his doctor visits, medications, premiums, deductibles, and copays. He basically died using a vacation day. Another state worker did retire early at 55, and then she had a horrible motor vehicle accident. She received wonderful medical care, but she couldn't afford all the rehabilitation, the medications, the ambulance rides to the doctor's office, and pay her premiums, copays, and deductibles. She went bankrupt because she couldn't pay for her health care. She lost her home. I hope the City Council will pass the resolution. Thank you for listening.
Thank you for your comments. Next caller, please. Welcome to the meeting. You have 2 minutes to address the committee.
Hello, my name is Shirley Toy. I was born and raised in Sacramento and have lived in District 4, 95816 since 1992. I'm asking the Law and Legislative Committee to support bringing a resolution in support of AB 1400 and HR 1976 to the City Council agenda so that it can be discussed and voted on and hopefully supported by the City of Sacramento. Healthcare is a very local issue. It affects every resident in Sacramento. I have been a nurse for almost 40 years and retired in 2019. I took care of patients on a daily basis who had bad outcomes for their health because they delayed care or could not afford maintenance, meds, or follow-up care. Consequently, their care was done often at the most expensive cost. None of us have any health care security. Even if you have good coverage, your network and providers, they change, and it's outside your control all the time. We are all one illness away from not having health care. I was the chief nurse rep at UC Davis, and I had nurses who spent their entire career taking care of others, but then they themselves got sick, couldn't work, and lost their coverage when they needed it most. Not very many people can afford to pay COBRA. Medical debt is the #1 reason for bankruptcy, and it saddens me to have to donate to GoFundMe accounts to fund friends' health care needs. And we have so many homeless people in the neighborhood, and who knows what caused what to make them homeless, whether they didn't have health care. Healthcare costs take up a larger portion of the budget of individuals, families, business, nonprofits, school districts, and the county, and even the city of Sacramento. COVID has shown how broken our system is. Some healthcare systems are making huge profits while their workers are working shorthanded with inadequate PPE, while a lot of care has been postponed. I strongly urge you to move this resolution forward to push our legislators to help us. AB 1400 cannot take effect until it is funded, but we need to pass the bill so that funding can be worked on.
Thank you for your comments. Your time is complete. Will you make your final comment, please?
Incentives out of health care. We need health care and not health insurance.
Thank you for your comments. Next caller, please. Welcome to the meeting. You have 2 minutes to address the committee.
Okay, thanks. Hi, my name is Philip Kim. I live in Southland Park, District 4. I'm a community organizer for the California Nurses Association. And I'm calling to ask the Law and Ledge Committee and City Council to pass a resolution in support of single-payer guaranteed healthcare legislation at both the state and federal level, specifically AB 1400, the California Guaranteed Healthcare for All Act, and HR 1976, the Medicare for All Act of 2021. Yesterday, you should have received by email an open letter from over 100 community members asking for you to pass a CalCare and Medicare for All resolution. Healthcare is an issue that affects so many of us here in Sacramento and across the country, and the current profit-driven system is harming so many people, especially now during the pandemic, where millions of people have lost or had their healthcare disrupted from a loss of job. Millions of people have lost their jobs. I just want to give a few quick personal examples of how our healthcare system is affecting us here in Sacramento, and myself personally. One, it affects our work and our wages. I worked for 7 years at Thunder Valley Casino. We organized a union. I became a shop steward, and I was involved in the negotiations for 2 of our contracts. And both times, we had to agree to smaller raises to keep our insurance cheap, especially for family coverage. That was the priority. And unfortunately, we had to sacrifice on our wages. And, workers in other countries don't have to do that. The second personal example I want to give is that almost a year ago now, my father was diagnosed with cancer. And fortunately, it was found in time. It was treatable, and he successfully went through chemo several months ago. And we weren't sure about it in the beginning, but it worked, and it was treated. And fortunately, he has good insurance. He had a good job. But arbitrarily, there was one particular drug that wasn't covered by his insurance as part of his treatment, and so he had to pay.
Thank you for your comments. Your time is complete. Will you make your final comment, please?
Sure, thanks. My final point is to please pass a city council resolution in support of CalCare and Medicare for All, like many other cities have done.
Thank you for your comments. Next caller, please. Welcome to the meeting. You have 2 minutes to address the committee.
Hi there. My name is Mokashmiri. I'm a resident of Southside Park. I'm also calling to support adding a resolution supporting CalCare, AB 1400, and Medicare for All to the agenda. This is not just a local issue for me, but it's a personal issue for me. I live near Southside Park, and I have a rare neurological disorder. And I remember a couple years ago losing my health insurance, and I was told that a 30-day supply of my meds per month would cost me $1,300. And even now that I have insurance again, I still I'm just exhausted of all the fights with insurance, of what's covered, what's not covered, all the reimbursements. It's overwhelming, and it's actually the hardest part of my disease is just managing managing the insurance process of it, because they have an incentive to not give care. This fragmented system isn't working for our residents. It's not working for anybody. And it's time for us to join the rest of the industrial world by adopting CalCare and Medicare for All. Thousands of our residents lost health care during this pandemic, and it's unconscionable. We need a system that has everybody in, nobody out. That's not job-based. We need to get rid of copays, deductibles, and have no more limits on which doctors you can see. And, I want to live in a city that shares my values. And for me, one of those values is just healthcare being a fundamental human right. But not just is it a fundamental human right, it's also cheaper than our current system. We have the most expensive system in the world with not great outcomes, to be honest. And this costs employers like the city millions of dollars for health care. Ensuring Medicare for All would increase the well-being of our community. No one would be able to be denied care or forced to use an emergency room because they don't have a doctor or health insurance, and nobody's going to be forced into poverty due to a health crisis. And also, local governments provide frontline response for community members who fall into poverty.
Thank you for your comments. Your time is complete. Will you make your final comment, please?
I hope you will support this. We really need your help and your leadership around this. Thank you.
Thank you for your comments. I have no more callers.
Thank you. Ms. Valenzuela. Thank you, Chair. I have 3 items, please, off agenda. First, I just want to congratulate Unite Here for winning statewide right to recall, and I thank Councilmember Guerra and those on the committee for working on advancing an ordinance to council. I do understand from staff that we need to provide some direction that we do not want that to proceed to council because Unite Here is happy with the state law as it was written. And so I wanted to put that out. Not sure if we need a motion on that at the next meeting or something, but yeah, okay. The second thing I wanted to raise was that I understand in October 2019, the Planning Commission approved consideration of conditional use for cannabis in C3 zones. And I was hoping we could agendize that at a future meeting for discussion as it's relevant in my district at this moment. And then finally, regarding the callers, I had advanced a draft resolution that I would love to agendize at a future meeting. Something that some of you might not know about me is growing up around the largest oil fields in California. I need daily medication to breathe for my asthma. And when I got to college, the cost of Medicare or my own health care, my deductibles and my prescriptions forced me to take a second job. When I finally got my first employer coverage, it was a high deductible plan. I went to the pharmacy to refill my prescription and was told it would be $2,400 for me out of pocket. And I just had to put it on my credit card because it was either that or breathing. So I would really like us to agendize this for future discussion at Law and Ledge Committee so that we can consider whether or not we can support a resolution supporting Medicare for All and CalCare. Thank you, Chair.